Thank you so much for your question. And you highlight some of the frustration that someone experiencing periods, particularly irregular periods, as you've described, will have, which is how do I plan for my everyday activities? I don't know. My period might come, it may not come. I want to plan a vacation. I want to be able to hang out on the beach. Can I wear white? Those are questions that people ask, especially when it's not a predictable cycle. And so I feel your pain. I just want to acknowledge that. And thank you for being so openly willing to share. So, the first thing that comes to mind in listening to what you were describing is you might have more than one thing going on. And like I was saying earlier with Viola, I always get troubled if doctors or clinicians are relying solely on imaging to tell you yes or no, something's going on. Sometimes we need a pathologist involved, but we definitely have to truly understand your full clinical picture. Unfortunately, for a long time, I mean decades, there was this school of thought that you can't have more than one thing going on in your body. And what that meant is for women, persons born with ovaries and uteri, is you were dismissed when you presented with whatever sounded as if it was just a little bit off for one diagnosis. And so, for example, in what you've described there, Ashi, I'm hearing things that makes me wonder, okay, could she have some either endometriosis or adenomyosis going on? Plus, could she also have PCOS going on, polycystic ovary syndrome? And so the reason why I'm thinking that is based on the symptoms you described. The problem is, depending on who you're seeing as a clinician, many of them were raised, and I use raised in air quotes, within medicine to believe you can't have both things at the same time, which is absolutely not true. We've now disproved that over and over, but many people are still subscribing to the old school of thought. And so what that means is they quickly dismiss or they do the hand waving, maybe it's hormonal, and they send you on your way. But that's not what's supposed to happen. So I would recommend requesting a follow-up visit to go back in. And some of the things I would suggest you ask about is, can you tell me whether or not I fit a picture for a diagnosis of PCOS, polycystic ovary syndrome? And to learn more about PCOS, feel free to come to our PCOS room, which we do every Wednesday morning at 7 a.m. Pacific, which would be 7:30 p.m. India Standard Time. But also asking more about your pain. Now, some things that you can do to help that also would be journaling. And so we talk about journaling a lot in this club because it is so helpful when it comes to presenting information, whether you're going to the emergency room to see your regular doctor that you see on a frequent basis, or you're seeing someone for the first time. It really gives perspective about what's going on for you. And so, your pain, is it only once you've started bleeding? Are you having pain in the days leading up to bleeding? So, even if your periods are not predictable, is it predictable in the sense that you always end up knowing when it's about to happen because a few days before, when you look back on things, oh, I was having pain. And so, that's why journaling would help because you can start really pinpointing sort of what might be what we call maliminal symptoms, which are things that finally herald that ovulation has happened or finally herald that your body is about to